Are you looking for world-class health and wellness advice combined with a dose of inspiration and spiritual encouragement? You've come to the right place. This is nourishment for body and soul. This is Manna, and I'm Dr. Turner. Welcome. Welcome, everyone, to another edition of Manna. I'm your host, Dr. Turner. It's great to see you all today. If you're joining us online or through Substack or on Apple Podcasts or Spotify, we're glad you're here. I have a very special guest, someone I met recently at the FLCCC conference in Pheonix. We had a great conversation. This is Dr. Kim Biss. She's an OB-GYN in private practice in Florida. And she has some really insightful, thought-provoking, concerning information based on data she has collected with her patients over the last several years and the concerns it has raised in her minds as regards the vaccine. We want to talk about that today. This is our opportunity to get into questions of the vaccines, how they affect children, how they affect mothers, and what she's seeing on the front lines of being a doctor. Very courageously stepping out and stepping forward to speak about this, to collect her data. She's actually testified before Congress. She's been quite publicized in this matter. There's a Substack article that you can look at from Jessica Rose about her. She's also been written up and hosted by the Vigilant Fox, amongst other people. So welcome, Kim. Very glad you're here today. And
thank you for having me.
Yeah, looking forward to the conversation. Just a little bit more about Dr. Biss. She graduated with a BA in biology from Mount Holyoke College. She went to Tufts University School of Medicine. She completed a general surgery internship at Emory University School of Medicine, did her OB-GYN residency in St. Petersburg, Florida, and has been in private practice there ever since. And she has a group practice now at this point with several providers. She says that she enjoys ice hockey, fermented grapes, lifting heavy weights, and cuddling with her dog, Ben. So good to get to know you in that respect, Dr. Biss, and very glad you're here. Welcome.
Yeah, thank you for having me.
Sure. Well, let's jump right into the punchline here. Talk about the miscarriage rates you were seeing, I guess, before and after the introduction of the COVID injections. And when did you first start to suspect a problem or a concern, and how did that come about?
Yeah, well, first and foremost, I never recommended these injections to any of my patients. We've never, as OB-GYNs, given anything brand new out of the gate to a pregnant woman for obvious reasons. And I was very uncomfortable with that from the get-go. But what brought this to light was in November of 2021, my biller in my office came up to me and said, Dr. Biss, do you realize that we've had a significant number of miscarriages this month? We've had 8, which in a practice that delivers 20 to 25 patients a month, that's a pretty high number. So I sort of loosely started keeping track of the data at that point. But what really made me do a deep dive was I went to the inaugural FLCCC conference in October of 2022 and met Steve Kirsch, who made a video of me that went viral about my miscarriage rates. And when I came home from that conference, my husband said, well, you better be right with your data. So I went back into my electronic medical record to January of 2020 up to November of then, 2022. And that was the data that I had sent to Jessica, which basically showed 2020 was a normal year for us. The miscarriage rate was 4% month to month, which the literature will tell us that the normal miscarriage rate is 13 to 15%. And in almost 30 years of taking care of almost 8,000 women that have been pregnant, I've never seen a miscarriage rate that high. And Naird et al. Actually showed in 2020 that a normal miscarriage rate is probably 5 to 6%. Well, mine was not even that high. In 2020, it was 4%. We had the most deliveries that year, which is probably wink, wink due to the lockdowns. We had a lot of deliveries in November and December. And we had a lot of newly registering pregnant moms in their first trimesters of pregnancy that year. Then when 2021 hit, the miscarriage rate doubled. I had said in my Steve Kirsch video that my miscarriage rate went up 50%, but I was incorrect. It actually went up 100%. So the average rate, and it peaked that November when my biller came to me, was 7 to 8% month to month. And then the following year, the rate doubled again to 15%.
Wow.
And that data was only up till November. In December of that year, it was 27%. And then in January and February of 2023, it was 30%. And
Whoa.
it didn't normalize back to 4% until June of 2023. And the concern is that the majority of my patients, because I also did a deep dive to figure out how many obstetric patients got the injections.
Mm-hmm.
And 70% of my population, which is commensurate with the Florida state vaccine stats, got these injections. But most of these injections were provided in 2021 and early 2022, and yet we were still seeing these effects in late 2022 and 2023.
Mm-hmm.
So very concerning. And the newly registering patients from year to year had gone down, which is suggesting either they miscarried prior to making the phone call to make an appointment, or they were having now infertility. We did see some patients that had no problems prior to 2021. We had delivered their babies. They had no, problems getting pregnant. And now they need to go see infertility specialists and get in vitro fertilization.
Mm.
So yeah, very concerning.
Wow. Very
Mhm.
concerning. My goodness. So just to reiterate there, it's your typical rate month to month had been 4%. It doubled again, and it peaked up around, I think you said 30% at some point.
Mhm.
My
Mhm.
word. Okay. And what was also interesting is that there was a delayed reaction. It seemed like a delayed
Mhm.
wave from when the vaccine boosters got introduced as to when these rates were peaking. Somewhere over a year later, the rates were still rising. Is that right?
Yeah,
Mhm.
exactly.
Right.
Mhm.
Wow. Okay. So that brings us to the question of the moment then, which is how conceivably are these ideas connected? How is it that the COVID vaccinations can be causing miscarriages, and how do we have a mechanism to understand how that might be building even upwards of a year after someone's gotten their first injection? I don't know, maybe they're getting boosters over that year, or maybe they just got one, and we think that the effect can linger for over a year. How do we understand that from a mechanistic viewpoint the best?
Yeah, so there's several, I mean, these are all theories on my part,
Sure.
but I mean, there's several mechanisms. We know first and foremost, we were all told it stays in your arm, which is insanity because we give a
Yeah.
lot of medications and muscles, and if they stayed in that muscle, what's it going to do for the patient? But we know from FOIA requested Pfizer rat trial data that the Japanese obtained, the lipid nanoparticles, which for your audience is the fatty envelope around the messenger RNA, that is found throughout the body of the rats and concentrated very highly in endocrine glands. And the highest concentration was in ovaries.
Hmm.
So the
Hmm.
lipid nanoparticles go to the ovaries. So that could somehow be at play. We
Hmm.
know that the spike protein goes throughout the body, and we know that the spike can cause inflammation, which is not good for anything with pregnancies, and also can cause clotting, which if there's some blood clotting at the level of the uterine lining where the pregnancy is trying to implant, let's say,
Yeah.
that could be an issue. The other thing, very early on, doctors were concerned with the fact that the proteins that are in the syncytial layer, which is the layer around an embryo as it's traveling down the fallopian tube to implant in the uterus,
Hmm.
those proteins are very similar to the spike protein.
Hmm.
So the concern was if the body makes antibodies to spike in a
Hmm.
female, then maybe
Yeah.
could perhaps be making antibodies to those proteins. So those are just my theories. None of
Yeah.
that has been proven, of course, but there are several, avenues that could be at play here. We know that lipid nanoparticles and spike protein get into the male testes. So that could somehow be the cause of infertility in couples if the man's involved. Um, and yeah, so
Hmm.
lots
Hmm.
of possibilities. And, we now know that when people get these injections, I mean, the spike protein can last for months to years. So
Right.
that could explain, the delay or the lingering effect that I'm seeing.
Sure. Yes. A great point. Great point. So we have the idea of the lipid nanoparticles dispersing, traveling everywhere in the body. Just for my audience, yes, those were meant as a drug delivery vehicle specifically to try to enhance uptake of small particles into our cells. So they're a dispersal agent and they work quite effectively. But in this case, carrying, some pretty horrible messages all around the body. So it helps bring the mRNA messages to diverse places with, as she said, a concentration in the ovaries and also the testicles to a large degree. Um, it's interesting. Naomi Wolf published a lot about this. And that's where I first started hearing about the reproductive effects and getting a little bit concerned. So if you guys remember, in terms of my audience, there was a bunch of information that Pfizer wanted 75 years to reveal, and they had to go. There was a court request that made them ultimately conform and start putting out the documents earlier than that, right? And what were the bombshells in those documents? Well, some of them were very striking. A lot of them had to do with maternal fetal health. For example, I'm just referencing one here. They looked at in just 12 weeks after the vaccine rollout, okay, 270 of the pregnant women in the Pfizer study reported an injury, okay, quote unquote. Now, we don't know what that was exactly. Pfizer only had time to follow up with 32 of them. So they captured about 10% of those pregnant women in just within 12 weeks who reported an injury. And then the 32 that they talked to, 28 of the babies died. Okay, so the injury was basically my baby died. Okay, and that's extraordinary. And they only talked to 32 out of 270 women. Who knows what it was in the remainder of them, right? So that was extraordinary. That was something that came out. And then there were these also reports of moms with reporting problems back to Pfizer, like my breast milk is blue or green color, right? Or I nursed my baby has rashes. These were some other things that also came out. And then we know that during the Pfizer study, they made demands of the male participants. Okay, so if you were a man, you had several demands placed on you to be in this study. Number one, abstinence or condoms plus highly effective contraception, in their words. Okay, and you were prohibited from donating sperm. So then the question is, why would they go through all of that hassle and concern if this weren't possibly transmittable through ejaculate and sperm material? So some striking
Correct.
concerns there. Yeah.
Yep.
Yeah.
Yeah, the miscarriage rate when Naomi compiled that data was actually 83%.
Was it?
Yeah.
My word. Okay.
Yeah.
Yeah.
And that also was displayed in an article that was published in the New England Journal of Medicine by Tom Shimabukuro. All
Mm-hmm.
the articles on that study, or the authors, were government employed or worked for the CDC or were on the vaccine advisory committee, so no bias.
Mm-hmm.
And that was sarcasm. And they had a cohort of 847 women and actually did the math wrong in the study. They came up with a 13% miscarriage rate, but when you actually did the correct math, it was 83%. So similar to Pfizer.
Mm-hmm. And this was across all of the vaccines? Is that the difference here?
No, this
Yeah.
was the V-Safe data they
Oh,
collected.
yes. Okay.
And the problem is they use the wrong denominator and
Hmm.
numerator, probably, because you can't include somebody in the third trimester when you're talking about miscarriage, because miscarriages only occur up to 20 weeks.
Hmm. Okay.
So when they used the right numbers, the miscarriage rate was actually 83%. And a letter was sent to the editor, and they
Wow.
still have not retracted that article.
They have not.
No,
Wow.
that's one of your links I sent you.
Thank you. Okay. What's the last name on that article again? I'll make sure we publish that.
Tom Shimabukuro.
Okay.
It's
Okay.
in the New England Journal of Medicine.
All right. And then you have the article, the sort of petition and request for correction as well.
That I
Linked up.
didn't send you. I can find it. It was a
Okay.
letter to the editor. Yeah.
Okay. Sure, sure.
Mhm. Mhm.
Wow. What's the current status of what we know about the spike protein crossing the placenta and its possible duration? Do we have any, you know, pathoanatomical data on that? Or
I don't think we have data, published,
Hmm.
but throughout conferences around the globe, Dr. Ryan Cole is one of the pathologists
Yeah.
who's shown lots of slides with spike all throughout the body, and definitely it has been found in placentas.
Wow.
There's
Okay.
a recent article that is in preprint now, but it's supposed to be published in what we call our gray journal, which is the American Journal of Obstetrics and Gynecology, showing fully intact messenger RNA
Hmm.
in placentas and umbilical cords.
Okay.
So we know that this goes to the fetuses for
Hmm.
sure. And
Hmm.
what's happening then, we don't know. But I fear this is going to be a multi-generational problem, because women, when they're developing in the womb, females,
Yeah.
they have all the eggs they're going to have once they reach 20 weeks of gestation or halfway through the pregnancy. They don't regenerate eggs like men regenerate sperm.
Right.
So if these lipid nanoparticles are getting into these female fetuses, ovaries,
Right.
what does that mean? We may not know until they either don't go through puberty or they can't get pregnant. But that's going to be years down the road before we find that problem. The other
Right.
concern I have is if, as you had mentioned earlier, lipid nano particle technology was actually originally developed to get chemotherapeutics into the brain and across the blood-brain
Right.
barrier.
Right.
So what could this possibly mean for our little babies' brains?
Hmm.
I don't
Hmm.
know.
Hmm.
It's just scary.
Indeed. Wow. And just to reiterate that point for my audience, you made an extraordinarily important point there about embryology and development for a female embryo developing. Okay. A woman has all the eggs that she'll ever have for the rest of her life developed by week 20, I think is what you said,
Mm-hmm.
right?
Mm-hmm.
So when a young girl in puberty starts to go through her cycles and her ovaries start to release eggs, there's a finite number of eggs that they start with. And that
Mm-hmm.
number does not get added to. It was determined not at age 12, not at age of birth, but actually at age week 20 is Dr. Biss's point. That's it. The
Mm-hmm.
developing baby ramps up and has a certain number of eggs, and that's it. And that's the max that baby will, and therefore adult woman will ever have, is determined at week 20. So therefore, anything that happens within the critical phase of development, the first 20 weeks of that embryo's life, will determine irrevocably the health and the later after effects for her whole life of how many eggs she has and how they might be able to be healthy and reproduce, whether they're damaged genetically, et cetera, et cetera. Yeah,
Exactly.
yeah, yeah.
Yep.
Very striking point. Wow. Okay, tell us as we wrap up here, then tell us a bit about the controversy going on in the world of OB-GYN, right? I mean, how are people thinking about this? How are your colleagues thinking about it? What are they saying at meetings? These shots are obviously being recommended. They must feel justified in recommending these on some level. So what's the state of the controversy here and where is it going? How is this all playing out?
Yeah, I think there's 62,000 OB-GYNs in the United States of America, and I can count on two hands how many of us are screaming from the mountaintops that,
Hmm.
Houston, we have a problem. And I
Hmm.
think it's multifactorial. I think first and foremost, ACOG, our governing body, American College of Obstetrics and Gynecology, came out in April of 2021 marketing these shots safe and effective. And last I checked, pregnancies are 9 months, and then what happens to the newborn? How do they know these are safe and effective 4 months after the Pfizer trials? Well,
Hmm.
we've since come to find out through FOIA requests that ACOG, through a trust from HHS, which is our tax dollars, received $11 million in April of 2021 to market this vaccine as safe and effective. And part of their contract they signed to get that money, they cannot retract anything that they've said. They can't turn around now and say, oops, our bad.
Hmm.
The other thing is, we've always been taught as OBs that respiratory viruses in pregnant women are going to be much more dangerous than if you're not pregnant, because of the anatomy changes, the decreased lung volume, etc. And and that's kind of the shtick to make us all give pregnant women flu vaccines. But I will tell you, in 30 years, I've never had a pregnant woman die of the seasonal flu. And actually, Beth Pinellas, who's a maternal fetal medicine physician in the Houston area, studied 26,000 patients, I want to say, from April of 2020 to April of 2021 that were admitted with COVID. Half were pregnant, half weren't. And the mortality was statistically significantly higher if you were not pregnant. So I think there's actually something protective in pregnant women, not the opposite. I don't think they're immunocompromised like we've always been taught. But the other thing I think is, when I started medical school training, was the concept of evidence-based medicine model, where every disease has an algorithm you go down, and then every treatment is a recipe. And if you veer off those algorithms or recipes, then you have to sit before peer review or possibly lose your medical license, right? So everybody follows the same paths. We treat all the patients the same way. We don't individualize patient care. And what does that also do? It doesn't make us think. Why do we have to think? Because everything's right here for us. So, and it also makes us not question authority. See? So I think there's a bunch of doctors that feel that, the doctors that are up in the ACOG tower, wherever that is, are smarter than us, and they know what's right for our patients. And if they say these are safe and effective, then they're safe and effective. That's my theory. There's no critical thinking anymore in medicine, sadly. It's groupthink.
Yeah, you're right. You're really onto something there, Kim. And it's interesting because I'm working with some other people right now on a curriculum. We're trying to develop a curriculum to restore critical thinking in medicine, apropos of everything you just said. But yes, that is a lot of the concept. We want things. There's been this push towards evidence-based medicine, towards conformity, efficiency, and whoever the really smart people were at the top of somewhere, Cochrane Review or wherever it was, that wrote the recipe, just follow the recipe, and there is a lot of conformity within medicine. Definitely, there's a lot of concern to be looked at sideways by your peers in making certain kinds of decisions. So,
yeah, I mean, medicine used to be the practice of medicine, right?
right.
And now it's just cookbook, everybody does the same thing. I mean, you have to, we don't all come off of assembly lines. We're not all the same. Every patient's unique. I mean, it's good to have guidelines, but those are guidelines. They should never be set in stone. I mean, look what happened with COVID. Fauci said this is the way and the only way. And there were various ways we could have helped our patients and not have them end up in the hospital.
Indeed. Yes. Well, we've got more work to do, don't we, within the medical profession? That's our side. I'm glad that you're out there speaking out. I'm hopeful that the two handfuls of doctors will double, and then double again, and that you'll just keep speaking up and advocating. It's vital. And, on the patient side, they need to know that there's someone advocating for them. There's someone willing to speak out, right, Kim? There's someone willing to take a little bit of an alternative viewpoint and think critically and ask some questions, even if the person's getting stones thrown at her. They need to know that we're fighting to save the soul of the medical profession, is what I feel like, to save its integrity, to save the doctor-patient relationship and the implicit trust that the public has with us. We're fighting to preserve that. And we're saying, hey, look, we realize there's some problems right now, guys. Hold on, we're working on it, right? We still actually care about patients. We didn't go to medical school and get trained just to be corporate peons and, lackeys of the pharmaceutical industry and greedy or anything else. We actually care about people. We're trying. We got some real systemic challenges we're fighting back against, but we're going to pull together and we're working on it. And so people can understand that, I think, and we have to keep stepping up and showing it as a profession. And I'm really glad to make your acquaintance, Kim, and through people that we meet at these conferences, et cetera. It's just the network keeps expanding outwards to bring some change.
Yeah, we're opposite ends of the country.
Yeah, I know. Well, I wish I could be out there sometimes. I'm in Washington State, you're St. Petersburg, Florida. Yeah, it's lovely. It's lovely out there. I've been to Clearwater Beach a couple times and had a great time
Oh,
there.
nice. Yeah,
Yep.
awesome.
Mm-hmm.
Awesome.
Well,
All
thank
right.
you
Well,
so.
thanks for having me and keep in touch.
Yes, indeed, we shall. Thanks for being on this morning. It was
All
fantastic.
righty. Yep.
Bye-bye.
Bye.
This wraps up another edition of Manna. I enjoyed our time together, and I hope that this has inspired you towards a healthy and happy life. Be blessed.